Cindy here, physical therapist with Adaptive Equipment and Caregiving Corner. Today we are talking about knee replacements, and I would like to welcome Lisa Phillipson with us today. She is going to share her experience with us. She works for Hospice of Southern Illinois. And Lisa, I would really like to thank you all for what you all have done during this COVID pandemic. You guys have been out there on the front lines trying to cheer everybody up.
We have. It's been a good experience. Last spring when this all started, we were like, what can we do since we can't, as the marketing team, get into some of the places that we typically had? So one of my coworkers found somebody that had costumes, and I can't tell you how much it not just lifted the spirits of the folks that were in the rooms and couldn't do a lot because of COVID. Right. It was just as rewarding for all of us. And they wave and they get excited and they say thank you and they blow you kisses. So it's been a good time. Every one of them have been a good time.
That is awesome. We really appreciate that. That's awesome. So let's talk about total knee replacements.
Okay.
So tell us a little bit about, so you had both knees. Okay. Both knees replaced.
Right.
So when did you have those done?
So my first one was in November of 16 and the second one was in February of 18. Because I just wanted to give myself about a year or so in between them. You never know what could happen, so that's why I waited the 18 months, but I also wanted to have the same physician. Right.
I understand that. So when we first met, I would have never guessed you had knee replacements. So obviously they've worked pretty well for you. They've done a good job as far as the replacements.
Cindy, it's changed my life.
Okay. Wow.
It hurt just to walk anywhere. I would have never been able to do these parades like we've been doing because the buildings, you think about big long-term cares and assisted livings, the buildings are huge.
Right.
The night that I knew I had to get it done, are you okay if I tell this story?
Absolutely. Go right ahead.
So I always think when it starts to impede things that you love, it was in August of 16, my friend Colette, her daughter was having a little bachelorette party. We were at Busch Stadium, the Cardinals. I'm a huge Cardinal fan. I love my friends. Couldn't wait to celebrate with Katie. And we're walking in, and I'm walking with my friend that's about 6 feet tall, so her legs are like pterodactyl long. My knee was hurting so bad I almost didn't want to go. And when you're not going for something people you love, in a place that is your favorite place, I knew right then I have to do this. I'm only in my early 50s, or I just turned 55. What, am I going to live the rest of my life like this? Right. So that's kind of where mentally I was like, okay, I'm ready.
Right. So I'm taking it that if you had it to do over again, you certainly would.
Oh, I should be on a billboard for it. Yes, absolutely I would.
That's right. You know, I tell my clients all the time when I see them, I know it's painful afterwards, but I tell them the arthritic pain that you were suffering before was not going to go away. This surgical pain, it will pass, but the arthritic pain doesn't. So, yeah, I'm sure that you were very glad that you did that.
Oh, exactly. And it wasn't too long afterwards. I was so glad I had done it.
That's awesome. That's awesome. So what advice would you give someone that was maybe contemplating having a total knee replacement?
Okay. So my first advice is, if it's starting to impede what you do and what you love to do, walking on vacation, walking at your job, first of all, educate yourself, find the right surgeon. That's my biggest thing. Then the next thing is make sure you go and get the right physical therapy done.
Okay. So
listen to your physical therapist.
That's it, a girl. I love hearing that. Love hearing that. So I know that you had talked about, or we had mentioned that you talked about, not judging yourself against your neighbors or your other friends that have had it done before. Would that be a piece of advice?
I would totally give that as a piece of advice because what I struggled with was the sleeping. And so other people are like, oh, I didn't have trouble sleeping at all. And you get on these Facebook groups and you're like, oh my gosh, I'm such a loser. Everybody has it at their own pace. As long as you know you're doing your very best, that's all you can do.
Right. That is very true. And that's what I tell my clients. Sometimes whenever I come into the home, the very first thing out of their mouth is, Sam down the street had this done yesterday and he's down doing cartwheels, I'm like, no. It's everybody's body's different. Everybody's recovery is different and how they tolerate things. I just try to really let my clients know, this is your thing. This is how we're going to take you, and we're going to take your progress, and we're not going to compare you to anybody else. So absolutely. When you go for right now for the pre-op process with with things how they are right now, we're trying to get people in, get people out. There's a lot of information being thrown at you, and our medical facilities do the best that they can, but it's a lot of information.
It is a lot of information.
Yeah.
And it's things like when I went to my meeting, they have the pre-meeting that you go to. I don't know if folks know this. I had to change my bed sheets 3 nights before I went into the hospital. The day I went to the hospital, I was to touch nothing going in. Everybody that went with me had to open my doors, and I love that.
Yes.
And so it is a lot of information, and they were very good at giving me something to take home to read. So I heard it, and then I took it home and read it. But keeping yourself from becoming infected, that's where it's a little overwhelming because it's a little scary because you don't want that to happen.
Right.
But guess what? I listened to everything they said, and I had no problems.
That's exactly right. That's exactly right. So if you knew now what you know, what would you do? Is there anything you'd do differently prior to surgery?
Well, first of all, I would have had it done faster.
Okay.
I had went to another surgeon that was giving me the shots in the joint, and he didn't like to do the surgery before somebody's 60.
Right.
And the physician that I found after that, he did, because honestly, do I want quality of life at 55 or 95?
Right.
Obviously I'd like it the whole way through.
Right.
But I'm really glad that I found that surgeon. So I would tell everyone, get it done. I can't tell you. I'm 59 years old. I have no aches or pains.
Yeah.
None.
That is wonderful.
Zero aches or pains. I will tell you to make sure you listen. Can I tell folks what I had in my house?
Oh, sure. Yes.
So my physical therapist, they told you the exercises to do prior to.
Yes.
And so I did those. I've never been a workout girl. I'm sure you can't tell. So, but the exercises that they did, I was very diligent, and I gave myself like a little circuit in the house. So I had the dining room chair in the kitchen area because it was tile, and I had like a cookie sheet.
Okay, yes.
So that I could put my foot and then slide it back. So I had that little area. I had my bed where I pull the stuff back, and then I had an area where the couch and like a little hassock type thing that we used to say, where my leg could go straight out.
Yes.
And then so that it would
your stretching.
Do my stretching.
Absolutely.
I did that 3 times a day, but I made myself do it. And you could really get rewards because you can see your knee bending, you can see your knee straightening.
That's exactly right. That's exactly right. As a physical therapist, I see a lot of total knee replacements, and that would be part of my, part of my preparation for my patients. I really promote trying to do those exercises ahead of time. The stronger that you go into a surgery, the more motion you have, as long as it's tolerable for you to do the range of motion before, the better you're going to be. The other thing I wanted to ask you about is your home situation, and I don't know, it's been a little bit. If you recall, a lot of my clients, when I go in to see them, these things are reviewed when they're going through their pre-op classes, but like getting a toilet riser and doing different things like making sure that you can get in and out of your chair, those types of things. But there's, again, so much information. A lot of people may think, my toilet's fine, I can get off of it. But a lot of times I go into these homes and people are just freaked out because they can't get off their toilet. They can't get out of their comfy chair because it's too low. I don't know if you had any experience with any of that, or
the whole thing you said about the chair, because the one chair, it has a pop-up thing to open it, but you got to have all your weight to push that back.
Yes.
And you don't think about that when you have 2 legs.
That's right.
All of a sudden you got 1 leg.
That's exactly right.
So we had to move chairs.
Yes.
Because I'd be stuck there.
Right.
So,
very true.
And I used my ice machine all the time.
Yes.
All the time I use my ice
That's your
machine.
best
I
buddy.
should be on a billboard for ice machines.
That is very true. That is very true. So with the chair, yes, absolutely. We talk to people about that all the time. A lot of times we recommend them actually raising that chair up a little bit with a platform, 4 inches or so, just to make it easier to get up and down. The toilet, got a lot of people that it's very difficult. It takes them by total surprise, especially if you don't at least have the comfort level toilet height. If you don't have a good place to push off of, or if you don't have the right height, it's kind of like I tell people, if you can't really get up off your toilet initially with 1 leg, then think about adding pain to that other leg and then trying to get up. No handholds, not the right height. So toilet height is something that we as physical therapists and Adaptive Equipment Corner really like to promote. comfy chair height, and then we look at bed height, because our beds now are so tall that a lot of people have trouble getting in and out of those safely, after a surgery and when they're in pain. So what I'd like to tell you is, if you guys have somebody that you know is going to have a total knee replacement, we'd like for you to check out our website at aecorner.com. We have a free home safety quick start guide. And while you're there, check out our subscription series. We also have a video series on how to prepare for a total knee replacement. Lisa, I really appreciate you being with us today. And again, we want to thank you for what you do for our community.
Thank you. Thank you for what you guys are doing.
Thank you very much. We appreciate that. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.